Good afternoon. My name is Sascha Jovanovic, and it's my pleasure to introduce Dr. Giacomo Fabbri to our discussion we're having today on the concepts of changing the placement of healing abutments into implants and changing prosthetic concepts. Giacomo, you are a prosthodontist with a lot of experience, and obviously you have used implants and healing abutments and various abutments in your clinical practice. And the question really is, what is the reasons for you that you're interested in now changing into something where you permanently place an abutment or a base right at uncovering, or maybe already at the time of implant placement, and basically take that implant from bone level more to tissue level? What are the advantages for you as a prosthodontist? What's the long-term effect of this? And how do you explain this behavior from a clinical standpoint?
Yes, as prosthodontics, I'm really interested to this new innovative concept because the possibility to have a soft tissue seal around our implants represents something of really priceless. We can get many advantages from this approach from a biomechanical and biological point of view. First of all, the possibility to move the prosthetic interface at the soft tissue level instead of at the bone level, it means to preserve the healing of the soft tissues, to preserve the connective tissues from the risk of contamination and irritation at the bone crest level, that we know how it represents an important problem. It could represent an important problem in terms of reliability of the final prosthetic outcome. So I'm really interested into this concept, like the new On-One concept, where we have the possibility to move the prosthetic interface from the bone level to the soft tissue level with two different height, 1.75 or 2.5. And also biomechanically speaking, I think that also the advantages are really amazing because we can move the stress from the bone crest to the soft tissue level. So it means to move all the complication from the implant level to the prosthetic level. So it's something that, for my side, can really beef up, can really increase the reliability of our restorations, both from a biological but from a biomechanical point of view. But honestly, I'm really curious also to know your opinion about this. You are an expert on GBR, treatment with implants over the aesthetic area. So what do you think about this, and how you think that you can take advantage in your practice from these new innovative solutions?
Obviously, everything we do in implant dentistry has, surgical implications, has prosthetic implications, but there's the biological aspect. So for me, being, of course, an oral biologist, I'm first of all interested in to preserve a connective tissue stability. Because in today's implant practice, there's many times that, for example, just the connection and disconnection of a healing abutment and then going down to an implant which is maybe deep in the tissues or sometimes even subcrestally, we're connecting an impression coping. And then we're doing a temporary abutment with some dental material like acrylic, which is being really moved apically into connective tissue. This is not a biological concept, so it's very unstable. So what we're basically creating is an unstable condition, which then for me as a surgical dentist means that sometimes I create bone through GBR procedures. Sometimes I improve soft tissues with soft tissue grafting. So I've now built up the crest. I've given the patient beautiful soft tissue, but now the connection from an abutment to the implant is so deep subgingival that now the tissues that we have created are actually being traumatized. And so we're losing tissue, which actually we have just developed. So for me, if we can prosthetically now take a component, an abutment, place it at one time, so that could be at uncovering, or if it's a one-stage procedure of implant placement, we place it at that time and don't remove it anymore. That's, of course, for me, a biologically very, very beneficial situation, because now we're taking the implant level, which is now the one I worked on by placing the implant and increasing the bone and thickening the soft tissue, and we're not anymore attacking it. So the connective tissue can really adhere, the seal can develop, and there's going to be some cellular activity, which again, promotes really stability. And then the restorative dentist can do something, whatever is the necessary thing prosthetically, at the tissue level. So for me as a surgeon, for me as a biologist, this makes completely sense. Now, of course, clinically speaking, there's going to have to be some adjustment. That's like, where a prosthodontist like yourself comes in to show what are the potentials to do this. But I think we're at a new era, and I'm happy that we as a prosthodontic surgical and biologist team, that we share the same common interest and that we are moving forward in a positive direction. So I think ultimately implant dentistry is going to benefit and the patient is going to benefit. So thank you very much, Giacomo. And it was a pleasure, ladies and gentlemen, to present this discussion here between Dr. Giacomo Fabbri and myself and introduce a new directions in implant dentistry and how we're changing components to improve our tissue stability around implants.